Cartilage and ligament, is it kind of the same healing process? Like, do they
No.
totally different? Because
Yeah.
this is cartilage that
So,
is messed up.
well, more than likely. A good question. What's the difference in healing between cartilage and ligament and tendon and bone and all of that? Well, bone heals the best, okay? Bone, osteoblasts, that type of healing is really good. So sometimes it's better to get a fracture than a sprain, because with collagen, there's always a challenge between getting stiffness. Now, it's a mild sprain, you heal, you recover, you go faster, but it's a complete rupture, then ACL is a great example. The ligament doesn't heal. You have to do a reconstruction. Whereas if you get a tibial fracture, it's worse, but depending on whether you need surgery, the bone does heal. So in the greater principle of things, bone heals well. Now, if you have a ligament injury, sometimes you repair the ligament, you reinforce the ligament, you reconstruct the ligament, different types of collagen in the different tissues. That's a whole basic science concept. We can probably do another segment one day on the different types of collagen, the types of healing, and when you get fibrous collagen, a certain type of collagen forming first that gets converted. And then we've talked about this before, Sharpie's fibers and Wolff's Law. When you start healing, then you want to start stressing it at a certain point. We typically talk that 6 to 8 weeks. Do we want to start stressing it? Because then the collagen fibrils line up better and they create that elasticity. And it's that type of, it's almost like you're telling and reminding the body of how the collagen fibers need to line up. Now, is it linear? No. Is it three-dimensional? Yes. Now, ligaments, bone, cartilage is different. The blood supply to the inner cartilage is very different. Most of the nutrients for the cartilage comes from the synovial fluid. That's the joint fluid. So that means that the blood supply going in isn't as good. So that's why when you get cartilage injury, if it's a large fragment with bone attached, it is better healing than if it's a flake of cartilage gone off. Now, sometimes you may try and repair and heal the osteochondral fragments, but some of the small fragments, there's not a lot you can do. You want to prevent that from being a loose body and grainy sand within the joint. So you have to flush it out and make sure there's no fragments within the bone. So there can be some loss of cartilage if you have a comminuted osteochondral or cartilage impact injury within the joint.